Hi, my name is Ruben Gobizi. I'm the director of the Cleveland Shoulder Institute. I hope you'll enjoy this video on the biceps tendon surgery recovery, and I really hope it helps clarify and reiterate some of the things we talked about in the office. Biceps surgery is very common. The biceps tendon is the most common pathological entity in my practice that I see, and what I mean is it's the most common thing I see that causes my patients problems, and essentially results in a what I call rotational deficit. A lot of people, when I tell them they have a biceps problem, they immediately think of the biceps curl, which makes sense. The biceps muscle, in fact, participates heavily in the biceps curl. But it's not the muscle that I actually have problems with. It's very rare that I have a biceps muscle tear. Far more common is a tear or a problem, and these come in 3 or 4 different flavors, with a biceps tendon that runs up the side of the arm that attaches that muscle to the shoulder. The biceps tendon itself does not affect the curl. In other words, you can have a biceps tendon problem and still be able to do a perfectly good biceps curl. As long as the elbow's to the side of the body and not out away from it, you can have a biceps tendon problem and still do a very good biceps curl. What you could not do is take a very light dumbbell, the same one you could easily curl, and, for example, place it in the back seat of your car. With a biceps tendon problem, what you lose is rotation of the shoulder. And when I say that, what I mean is this: putting a coat on, reaching the back seat of a car, women to do their bras, pulling a t-shirt off, pulling a seatbelt over, reaching for the nightstand light. Any rotatory motion, and certainly throwing a ball would be the penultimate of the rotational motions, but any throwing motion would really cause a sharp pain, most commonly in the front of the shoulder, but it can also be behind the shoulder, because the biceps tendon moves with the forearm, because it runs down a groove in the front of your arm. I have a very nice article on my website. If you go to the patient education page of the website and look under anatomy, treatment, and rehab for biceps tendon injuries, I've written an article with nice pictures that I've probably shown you in the office, or at least drawn for you in the office, demonstrating how exactly this works. But make a long story short, that's the skinning. It's biceps pain with rotation. It's pain with the arm, in the arm, with rotation of the shoulder. If you come and typically I do surgery on these if somebody's failed ultrasound guided injections, if they've done sometimes therapy, although I don't find that therapy really helps for biceps tendons, and time. Usually my patients, it's clear to them that they're not getting better. I don't need to tell them that, and it's usually after that time. The recovery is pretty straightforward. The surgery takes me about 10 minutes, and again, you can watch a video of me actually doing the procedure step by step on our website. If you go again to the patient education page and scroll to the bottom of that page, and you will see biceps tenodesis. If you click on that, there's a 2.5-minute video or so where we walk you through exactly how I do that surgery, but nevertheless, it's a quick surgery, and the recovery is relatively straightforward. I will show you how this works. But most people, I tell them this. I do this on a lot of baseball players, tennis players, volleyball players, and then regular people like you and I. But I typically will say in broad strokes, I'd like somebody you can take the sling off after the surgery. You can use your arm for activities of daily living, that is, to eat, to drink, to shower, to shave, and to dress. Those type of activities, right out of the gate. I'd like you to have good range of motion, and more than just eating, drinking, shower, shaving, dressing, between 3 and 6 weeks after surgery. You'll still be sore if you try to go behind your back down the side of your arm. That's normal, even at 6 weeks. But you should have pretty good motion otherwise. I typically will stop therapy at 6 weeks, and I don't like strengthening until you get to 4 months. Once you get to 4 months, we have an excellent rehab video on our website, again, under the patient education page, called the Fabulous 6. It's a nice 6 workout exercises that involve weights that will strengthen all 17 muscles about the shoulder. And really, we like that because it keeps the elbow within the plane, as we call it, because you really get in trouble when you take stuff out where the elbow goes away from your body. We don't like you to do that for 6 to 9 months after surgery. But you can do a lot of things like curls, triceps, rows, pull downs, bench press with dumbbells, starting at 4 months after surgery. But again, that's on the website under Fabulous 6. Otherwise, I'll now show you how I want you to rehab the shoulder as you go through the process. Thanks.
So first we're going to talk about biceps tendon surgery recovery, exercises, how I'd like you to do it. I want to start off by showing you that this is the position I want you to start the rehab in. All exercises, even when you go to a therapist. And mind you, this is very important, okay? I'm showing you these videos, I made these videos because I want you to understand what therapy looks like. In other words, when you go to a therapist, I don't want them doing whatever they want. I want you to have a good understanding of what I want you to do. And then keep them honest, if you will, and have them do these exercises in plane. For the biceps surgery, everything starts lying supine, which is supine is this position, lying on your back, and everything stays in plane. When I say in plane for the biceps, what I mean is not out to the side, but in the plane of the shoulder joint like this. Okay, so no exercises out this way or no exercises behind you. Everything is in motion this way. Okay, so first thing you're going to do is day 1 surgery, you come home, you do activities of daily living as we described earlier, but then post-op day 2 or 3 you should be in the therapist office arranged before surgery. Okay, very important to arrange all that stuff, like we give you the scripts and everything. Call before surgery because you can't always just get into a therapist depending on where you live. So first thing I want you to do is have them take your arm just like this and take it up like this and back down. Obviously doing that all the way like we just did with Janice is not going to be that easy day 1, but this is the goal. Just plain a motion like this. This should be for the first week or so, maybe even 2 weeks for some of you, depending on your pain tolerance. But basically, I want this motion. And oftentimes, I want the elbow. Here's the elbow. I'm going to bend this elbow, Janice. The elbow, the hand should be supported behind the elbow. If you do it up here, the person can go high and think, oh yeah, I'm moving, but the shoulder isn't moving. So you have to have the hand behind the elbow and stretching it out like this, okay? Best to have somebody help you with this the first week until you can feel more comfortable getting the stretch all the way back, okay? Really, it's best for somebody to help you. And you don't have to wait to go to a therapist to do it. You can do it at home. Post-op day 2 or 3, have your wife, friend, whoever do that for you and really get you moving in that plane, After week 1, when you should have achieved, or 2, you should have achieved that kind of motion. If you don't achieve that kind of motion, call us and I want to see it. I want to see you because you should be able to do that within 1 to 2 weeks. After you do that motion in 1 to 2 weeks, then you can do it by yourself. Sometimes I'll have you put a pillow here and just hold your arm up here like this and start from this position, but then I want you to go ahead and go up yourself, and that's really the goal, is to go up and down just like Janice did as a therapy. That's week 2 to 3, okay? Once you do that, you'll have recovered, many of you will have recovered from the acuteness of the pain from the surgery, typically down in this area here. And you can sit up and do it probably yourself, and the next motion is just to raise your arm up. If you need to, take a towel facing the wall, not to the side like this, facing the wall, and slide your arm up the wall. Yeah. So, well, actually, yeah, you don't have to do it. You can. That's fine. This is the most important. And slide your arm up the wall. After that, you should just be able to use it and do it in the mirror like this. And you can use pulleys that the therapist give you. But what I gave you is the key part. At 6 weeks, I'm going to have you walk in. I want you to be able to just raise your arm up. All right, and that's key for how I check, yes, you're doing well. And typically, I'll have you stop therapy at that point and just start to do activities, as we described earlier, cycling, swimming, biking, that kind of stuff. And then once you get up to 3 months, we can start your golf program or whatever kind of activities tailored to what you like to do. Thanks.